Emma Sutherland here at the NHAA 2023 Naturopathic Symposium. With us right here, we have Associate Professor Greg Connolly. Now, we're going to ask Greg a little bit about the presentation he has just walked out of. Greg, can you tell us what you were talking about?
Well, we covered probably three main themes. First, we looked at, as a practitioner, how we're going to deal with cancer patients, how is best to manage what's going on for them, and talking about the different styles of treatment. And there's three different styles of treatment. You can do a holistic treatment, which looks at the whole person, how they are physically, how they are emotionally, how they are spiritually. And then you can look at what I would call complementary medicines, which is this is the suite of therapies that are used when someone's undergoing surgery and chemotherapy and radiotherapy. What natural remedies can assist with that? How can you assist with the side effects of that? And then we talked about, okay, what are some of the primary treatments, which are the treatments that can be used in a direct way to try to reduce the cancer.
Wow, it is such a behemoth of a topic. It makes me as a practitioner feel completely overwhelmed and out of my depth, even after 20 years. So having the expertise of that session, I'm sure, would have been so helpful for many practitioners.
Yeah, well, we delved into areas that aren't spoken about much. We talked about the dying patient. So we talked about what's it like to be in the present of someone who now has realised that there's no further things that can be done, and the importance of being a practitioner of just being with them, that you've now, you're not striving for treatments, you're not striving this extra effort, and there's many patients that go through what I call a transition where they've come to accept what's going on for them, and they now realise they've got a year to live or 2 years to live. And it's quite a profound change. It's hard to describe, but it's kind of like a spiritual change. And it's really nice to sit with them and talk with them, and they're a lot more settled. When people are in acute care and they're very frightened and stressed about their cancer and worried about it, it's good to, when people are perhaps unfortunately in palliative care, but they make there's some other healing. The physical healing can't be carried any further, but the emotional and the spiritual healing begins to take place at quite a different level. So that resonated with the audience really well, I think.
Yeah, well, it's resonating with me. It is so multi-layered, and it is an area, that palliative care area, where we don't talk enough about it, and we have incredible skills, listening skills, that will help patients in this exact space. Yeah.
So we also talked about the communication with health professionals, particularly the medical teams at the hospitals, and one question that was asked, so what are the attitudes of the medical professionals, the oncologists and the radio-oncologists and surgeons about that? I did my PhD in that area, and we discussed that, look, it has changed, because I've been in this area for 30 years, and 30 years ago I think many cancer specialists were vehemently against any form of complementary medicine. I think that's softened a bit. I think there's still pockets of those specialists who actively discourage their patient from any form of care, and that even might include yoga and stuff. I don't do that, because they often see their patient. They fear that if their patient goes down this path of beginning to use complementary medicine, that there'll be a flight risk, that they'll stop their hospital care and they won't come back. But for my PhD, when I interviewed patients about it, they said no, and the other research backs this up, that pretty much 99.9% of patients, when they've got cancer, they want medical care. It's uncommon. The three of us on the panel all spoke. It's quite uncommon that patients will reject the medical care. So I think the medical specialists do make an assumption, a false assumption really, that that patients they're desperate and they're irrational, but the patients I spoke to said, no, I've been using vitamins my whole life. I just want to know, can I continue them while I've had breast surgery and things like that? Because often the doctors say, don't take anything while you. So they're the kind of things that we spoke about, and that resonated with the audience quite a lot. And we talked about, the dying patient, as I said before, how you need to, as a mature professional, how you need to move beyond the protocols of treatment and what can you do. You reach a point, okay, with some patients, there's nothing more than you can do, but what you are doing is important, which you're being with them. And you're a witness to what they're going through, you're a witness to their suffering, but you're also a witness to their change, their acceptance, and that's a very special place to be as a practitioner.
Well, there is so much in this, but I feel like we could learn so much more. So thank you for sharing your wisdom with us today.
Yes.
We'll be back next week with another episode of interviews from the speakers here at the symposium.